Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor and Wellness Clinic. We're talking about developmental kinesiology and a combination move that is my favorite that strengthens so many different muscles in your body. It's a good one to do on a daily basis, so stay tuned. Thanks for watching. Let's talk about this, my most favorite developmental kinesiology DNS move. So in this pose, your back foot is at a 90-degree angle. The knee is in the arch of your front foot. You are as opened in the hip joint as you're able to, and you're engaging your pelvic diaphragm. There's a video on that. And your spine is in a neutral position. The upper part of your back is in a straight, not pushing your chest out or slouching. You're in an elongated spine pose. Everything is nice and neutral. You glide your neck back. You're gonna, if you need be, you can hip hinge forward, not slouching forward, but hip hinging forward. That's a movement right at the hip joint. So you're gonna go up, and as you go down, you're gonna hip hinge back. And just as you get close to the ground, you're gonna go back up. Just like that. So now we're gonna combine it with other things where you go with the legs straightened, just like that. Your knee's not going to be wobbling back and forth or side to side. You're going to push off, which is what we did at 11 months of age. You're going to push off the back foot and keeping everything leveled, just like that. Now you're going to swing that way. Boom! You got it. Thanks for watching. Take care.